history is not shaped by one generation alone, but by those who came before and those who rise after.
In Part 1, Africa's young advocates raised their voices with courage and conviction. Today, in Part 2, the continent's most respected scientists, ethicists, professors, and policy leaders step forward to stand beside them. Now, they unite with one message.
Science without policy is a promise without action, a seed without soil. These leaders believe the time has come for one mission, one continental voice, and one goal: a genomics policy for Africa by Africans. From established scholars to pioneering researchers, from seasoned clinicians to bioethics champions, they lend not only their expertise, but their trust, their guidance, and their unwavering belief in the next generation.
Today, they stand not in front, but beside Africa's young advocates. Together, they form one continuum, one movement, one Africa. This is Part 2. The professors, the experts, the guardians of the field.
Good morning. My name is Nikki Mulder. I'm a professor of computational biology, and I've been building capacity in genomics in Africa for more than a decade. So genomics has the power to transform many things in life, both our health, our food security, pathogen surveillance, and many other applications. For researchers, it enables us to better understand diseases. But for patients, it could mean the difference between life and death, disease prevention, and particularly for rare disease patients, it actually can give answers where there's been mystery to date and give communities, children, and families a future. But the problem is that if Africa does not lead in genomics research and implementation, we risk being left behind, and particularly we risk solutions being developed that are really not appropriate for our populations. So we know that Africa is the home to the most genetically diverse population on Earth. This is a challenge, but also an incredible opportunity. So when African scientists lead in genomics, we generate data that truly represents what we need, and we can create treatments and prevention strategies that work for our people, but they're also, of course, globally relevant. So we think that even though we were the birthplace of humanity and we've been left behind to date, this is really a time where we can start to lead in genomics. But the call to action from me is for the policymakers. We need to invest in genomics infrastructure as part of national health strategies. We need to support African-led initiatives. So we need to commit to long-term funding. We need to commit to workforce development. We need to build capacity and leadership in African genomics that can really tackle genomics and enable it to give us health solutions. We need to advocate for equitable access to every African, regardless of where they live, that they can benefit from breakthroughs in genomics. And this requires policy change. It requires the leaders to understand and recognize the benefits that genomics can bring to its people.
I am Dr. Hani Slim, the coordinator of the Egyptian Network of Research Ethics Committee, ANREC. I believe that without robust genomic policies, Africa risks being a data source than a knowledge leader. We must own our genetic narratives. My message to the WHO and AU is to urgently support continental framework that ensure equity, ethics, and African scientific sovereignty. Thank you.
Hello, I'm Dr. Conor Diegbe, and I co-lead the Psychiatric Genomics Consortium Africa Working Group. It's an organization tasked with implementing the development of psychiatric genomics on the African continent. I believe that policy advocacy is the heartbeat of Africa's genomic future. Every sample, every dataset, every discovery carries a story of people, communities, and possibilities. And without policy, these stories risk being written elsewhere. In psychiatric genomics, the field in which I work, the stakes are especially high. Mental health is one of Africa's fastest growing challenges, yet it remains among the least resourced. Through my work, I see the great work which Africa's scientists are doing on a daily basis to map the genetic basis of disease and especially mental illness. And through initiatives like PGC Africa, we know that African scientists are ready to lead, but need enabling policy environments to secure data sovereignty, promote equitable partnerships, and integrate genomic insights into national health systems. To the World Health Organization and the African Union, I would say that Africa is ready. We have the science, the talent, and the vision, without a doubt. What we need now is continued support for continental strategies that embed genomics within Africa's public health agenda. Thank you very much for listening.
I am Julie Makani, Professor of Medicine at Muhimbili University of Health and Allied Sciences in Dar es Salaam, Tanzania. I just wanted to first talk about the major advances in genomics. Colleagues started the GGTI, which is the Global Gene Therapy Initiative in Africa, efforts to increase the progress or accelerate the progress to have gene and cell therapy in Africa. And there has been success in Uganda with cell therapy for HIV, as well as in South Africa with gene therapy for hemophilia. In Nigeria and Tanzania, these are two countries in Africa that have made progress in treating sickle cell disease using bone marrow transplant, which is a type of genetic therapy. Tanzania has been able to establish advanced therapy program at Muhimbili University, and they have been successful in establishing a bone marrow transplant unit with successful treatment of sickle cell disease. We need to make sure that individuals, whether they're patients, providers, or scientists, individuals are part of the process of advising genomic policy.
Good morning, good evening, good afternoon from wherever you are globally. My name is Professor Bernard Mori Sore from Moi University, Kenya, a member of the Sickle Cell Federation of Kenya, a member of the Sickle Cell Disease Control and Registry Program in Kenya. I'm here to talk about the need for rooting for genomic policies at our local level as a country, as nations in Africa. This is because over 80% of all cases of sickle cell disease globally are found in Africa. In the year 2021, for instance, we had 7.74 cases of sickle cell disease globally, and 80% of this is found in Africa. Of all the births in Africa, especially the sub-Saharan Africa, are affected by sickle cell disease. And from our own expert point of view, we can prevent the birth of sicklers if the right information is given to the population and the right policies are put in place. I'm therefore rooting for organizations like World Health Organization, organizations like Africa Union, and national ministries like Ministry of Health to enforce policies that support genomic interventions so that this is a sustainable way by which people living with sickle cell disease can be helped, and the country can also curb the spread of sickle cell disease in Africa. Thank you.
Hello, this is Hinda Tayyibi, a professor of health economics and pharmacogenomics, German University in Cairo, Egypt. Genomics policy advocacy is vital for Africa's scientific future. Strong policies that are grounded in health economics are essential for innovations, accessibility, and sustainability. We need to empower a new generation of African genomic policy leaders who understand both scientific evidence and economic value. A message to the WHO and the African Union. We need to support Africa in building integrated genomics and health economics policy frameworks that secure our leadership in precision medicine.
I am Dr. Olufemi Samuel Amo, an immunogenomist from Nigeria. I believe that policy advocacy in genomics matters for Africa's scientific future. This is because genomics policy is a shared responsibility. When African nations have clear regulations, strong data governance, and equitable research partnerships, the entire world benefits. Therefore, let us build together a future where genomics advances are created with Africa and not just for Africa. By so doing, we will be strengthening together global health security. Thank you.
Hello, everyone. My name is Mbiaton Nanciel. I'm a scientist from Cameroon. So regarding African genomics policy, I believe genomics is the future of the life sciences, and as such, every nation should be able to have the power to harness this tool for the benefit of its population. And developed nations are already doing this routinely, and I think Africa shouldn't be left out, which is why PAPERI has taken it upon herself to train African leaders on genomics policies, such that they can come up with tools that will guide genomics across Africa. The focus here is to ensure that Africans are on equal ground when collaborating with foreign partners, and also the other focus is to ensure to develop frameworks that will safeguard the African interests. So my message to the WHO and the African Union is that they should help us make this dream a reality. And also, I would like to plead that they take on their role as the regulatory authorities to ensure ethical implementation of and adherence to proposed policy, to propose and validated policy frameworks. Yeah, thank you.
Assalamu alaikum. Hi everyone. I am Khalid Adli Muhammad Khalid, Professor of Genetics and Bioinformatics at Bani Saif University, Egypt. I believe that the genomic revolution holds immense potential to transform global health, but realizing these benefits require robust, equitable, and sustainable policy frameworks developed with strong institutional support. We urge the World Health Organization (WHO) and the African Union to amplify their collaboration and technical assistance to member states, specifically focusing on helping them draft comprehensive national genomic strategies that integrate disease surveillance and clinical care, establish strong ethical, legal, and social governance for data sharing and privacy, mobilize sustainable financing beyond emergency funding, and accelerate workforce and infrastructure development. For example, bioinformatics sequencing to ensure the benefits of this technology are accessible to all populations and contribute meaningfully to global health security and universal health coverage. Thank you.
Hello, my name is Rasha El Kafas. I'm an assistant professor at the Faculty of Medicine, Cairo University in Egypt. I believe in a pan-African human genomic policy that made by Africans and for Africans. For the WHO and AU, kindly support a group of enthusiastic policy advocates from Africa and for all Africans.
Hello everyone, I am Dr. Muhammad Zahir Ali Mohammed from Muhimbili University of Health and Allied Sciences and the Tanzania Human Genetics Organization. I believe Africa's scientific future depends on strong and locally led genomic policies that protect our communities, ensures ethical practice, and translate discoveries into better health. This requires empowering a new generation of African genomics policy leaders who can bridge science, ethics, and law. I therefore urge the World Health Organization and the African Union to support a coordinated, equity-driven genomics policy vision that places African leadership at the center.
Hello, my name is Madiha Ashoub. I'm an assistant lecturer of oral pathology from Cairo, Egypt. Growing up, I've always been driven by one question: what makes each of us unique? As a researcher, I've later learned that the answer lies in our genome. See, in my field, where we study cancer and developmental disorders, we often see patterns that suggest unique genetic and epigenetic signatures. These patterns differ between populations and even among African communities themselves. However, this diversity is not an obstacle. It's rather a scientific opportunity that holds the key to personalized medicine. Yet, for decades, global genomic research has relied on collecting data from outside Africa. To make science truly representative, African nations must build strong genomic frameworks and lead research that reflects our own people. See, we are one continent, yes, yet we're incredibly diverse in our genetics and stories. While this diversity deserves to be studied, understood, and protected through fair and ethical policy. Hence, I call on the WHO and the African Union to support the development of genomic frameworks that safeguard our data and benefit our communities. I believe that Africa's genomic story is still being written. So let's make sure we are the ones holding the pen.
Hi, my name is Dr. George Batista de Rocha, and I'm from South Africa. It is more important than ever that African governments unite to establish policy frameworks for use of genomic data. Genomic data has a wealth of potential to be used in health, in population understandings, in uniting our continent, and it's up to African scientists to take the lead and initiative on that. Otherwise, we leave it up to the other global powers to step in and use that data for what they would do. We need to own it, we need to share it, and we need to manage it across the African continent. Good luck with this initiative.
I am Dr. Kaius Kipchumba Kiring, a pharmacist from Kenya, and my message to the WHO and the African Union on the strengthening of genomic policies across Africa. As a pharmacist on the forefront on medication safety, public health, I do recognize the need for strong coordinated genomic policies across Africa. The continent stands at a pivotal moment where advances in genomics can transform disease prevention, disease diagnosis, and disease treatment. Yet gaps still exist in regulation, data governance, and equitable access continue to limit this progress. As a pharmacist, I stand ready to contribute through medication stewardship, pharmacovigilance, and patient-centered genomic counseling. With clear policies and strategic investment, Africa can move from being a participant to a leader in genomic medicine. I do urge the WHO and the African Union to champion this agenda with urgency and commitment, because the future of healthcare in Africa must be ethical, equitable, and genomically empowered. Thank you.
Hello, I'm Dr. Alassane Dabo from AKA Medical Diagnostics Center. I strongly believe that policy advocacy in genomics is essential for Africa's future. Genomics has the power to transform healthcare, improving early diagnosis and treatment of diseases to save lives. But without a strong policy framework and ethical guidelines, our continent risks to fall behind. We need to train African genomic policy leaders who can shape decisions, protect our data, ensure that scientific progress benefits the continent. I call on the WHO, the AU, to support a coordinated genomic policy strategy for Africa. Africa is ready. Our African scientists are ready. The time to act is now.
Hello, my name is Martha Luca, and I am a PhD student at the University of Glasgow. It's not uncommon to see scientific insights remain trapped in academic papers rather than inform public health decisions. The COVID-19 pandemic had a silver lining, which was the advancement of genomics, not only in Africa, but globally. But without a robust policy framework and support for policy translation, this scientific excellence will not translate to better outcomes. For Africa to lead in addressing our unique disease burdens, we need more than technical capacity. We need African scientists that can bridge the gap between complex genomic data and actionable policy. We need platforms where genomic insights will be able to shape continental health strategies. And this is not just supporting us as researchers, but as policy architects for the future of Africa's health. Thank you.
I am Dr. Laiton Awe, the current training officer for the African Society for Bioinformatics and Computational Biology. I'm a Nigerian and I lead the Omics Coder Fund, which is a global initiative for bioinformatics capacity building. I believe that it is important to train and empower African genomics policy leaders so that we can have more representation of Africans in genomics.
Hello, I'm
I'm Dr. Dina Akini from Kings and Queens Medics, Kenya. Empowering African genomic policy leaders ensures our scientists can shape policies that are ethical and locally relevant. Investing in this leadership is investing in Africa's scientific future.
Hello everyone, I'm Dr. Ahmed Hindawi, a researcher of pharmacology at Theodore Bilharz Research Institute in Egypt. As a scientist in Africa, we stand at a defining moment for genomics. The knowledge, talent, and infrastructure now exist in our continent. We are ready to lead. I fully support the Voices of Advocacy campaign and the call for World Health Organization and the African Union to strengthen and support the African leadership in developing genomic policies that serve our people and shape our future. Africa is ready, not just to participate, but to lead.
I'm Dr. Kazim Adewale Solali from the Nigerian Institute of Medical Research, Yaba, Lagos, Nigeria. I believe policy advocacy in genomics is crucial for Africa's scientific future because it empowers our continent to harness the potential of genomic research while ensuring ethical and equitable practices. My message to WHO and the AU is, let us all work together to develop genomics policy frameworks that support African scientists and prioritize our unique needs. Prioritizing our unique needs will go a long way, for better development and informed policy in genomics. Thank you.
I'm Dr. Crispin Bogovani from Zimbabwe. I advocate for the WHO and African Union to support genomics policy development and training.
I am Jacob Ayembila, a lecturer from Accra Technical University, Ghana. Africa contributes only 1% of global genomic research, despite the continent's rich genetic diversity. However, models developed with European data are less sensitive to Africans, and limited infrastructure and researchers hinders our progress. We must invest in genomic research infrastructure, training, and capacity building in Africa. We must promote diversity in genomic research, develop tailored solutions, and support collaboration in this age of precision medicine. To the WHO and African Union, I urge you to support genomic policy development in Africa. Let's work together to unlock the potential of genomic research and improve health outcomes for Africans and the global population. Thank you.
In the story of Africa's scientific awakening, justice is not an afterthought. It is the heartbeat. To guide this future, we need voices that defend rights as fiercely as we pursue discovery. One such voice from Uganda now joins this movement.
Hello, my name is Melina Nyonga, a lawyer from Uganda. I'll be speaking about genomics, healthcare, and legal frameworks today. So, genomics is transforming healthcare, and strong legal and ethical frameworks are essential to guide this progress. Now, I stand with African scientists, clinicians, and policymakers in calling for a genomics policy for Africa by Africans. One that protects our people, upholds justice, and ensures responsible use of genomic data. It's time for Africa to act and to lead.
Africa's advocates have spoken. Africa's experts have answered. 2 generations, united by purpose. 2 voices, now one movement. Today, the continent's most experienced leaders stand firmly behind its rising advocates, declaring that Africa's future in genomics must be shaped with intention, with equity, and with African leadership at its core. Because science without policy cannot protect our people. Because expertise without action cannot transform our future. Because a movement without unity cannot shape history. But today, Africa is united. Together, the advocates and the experts call for one urgent goal. Sparkles a genomics policy for Africa by Africans. This is more than a message. This is a turning point. This is a promise to the next generation and to the world that Africa will not wait to be included. Africa is leading. Part 1. Part 2. One movement. One voice. One Africa. Let the world listen.